Well, hey Gina, welcome back. How are you doing today?
I'm good, thanks.
What's been going on?
I'm still having a lot of pain like I talked about on the phone. I'm starting to worry now just because it's progressing. I feel like it's getting worse. Yeah, I think it's really starting to affect my everyday life, so it's getting frustrating.
Oh. And how long has that been going on?
Right now it's about 4 months that it's been happening. So I'm sort of starting to wonder how long it's supposed to last, because I've been hearing different things and it feels like forever at this point.
Yeah, it sounds like you have chronic pain since it's been going on more than 3 months.
Mm-hmm.
Normally it could take weeks, months, or years to deal with chronic pain, unfortunately.
That doesn't sound nice to hear.
But you know, you're not alone. 1 in 5 people do suffer from chronic pain, and there are a lot of interventions to deal with what you're going through.
So, well, that sort of makes me feel better, just because people are starting to make me feel that I'm exaggerating and making things seem a little bit worse than they actually are. So that's a little comforting to hear. What else is there? Like, what else do you think what do you think I can do to help with the pain? So far, I've just done a lot of physical therapy, and it seems a little useless at this point and time consuming.
Right. Well, you know, clients normally do fear that they have been accused of making up the symptoms or causing them on purpose, but you and I both know that this is really serious and it's time to take some interventions. You know, the emotions that are in the large part the chemicals that are released into our muscles and our organs. So your emotions are taking a toll on you now with the pain that you've been dealing with, and it can cause the real pain. You know, I know what you're going through.
That's comforting to hear. What do you recommend for your clients who are having chronic pain besides the physical therapy?
Oh, so you did start the physical therapy?
Yeah, I've done a lot of that, and it doesn't seem like it's really doing too much, right?
Well, you do have several options outside of the home and while you're in the home. The ones I'm going to highly recommend, you know, continue to see me. I don't want you to get any more anxiety or worries, and that be another thing that you have to deal with on top of the chronic pain. So you can continue to see me every other week, like we've been doing, so your pain doesn't take over your life, like you said. You also need to make a plan to meet with your doctor at this point. You know, you said it's been 4 months. I highly recommend you go see a doctor. There's some things that he can prescribe that I'm not able to, that can help you manage the pain. And you can also do occupational therapy as well.
Mm-hmm. The occupational therapy is a little iffy. I have so much going on right now, so the thought of going to the physical therapy and, you know, sort of doing the same thing with the occupational, I don't know how realistic that is. Is there anything I can do at home or something that just doesn't require a lot of time?
Well, I know you said you didn't like taking medications. I've had quite a few patients of mine who have used a topical administration that avoids the systemic side effects. It's actually called capsulin patch. I'm not sure. I'll spell it for you. It's CAPSALCIN patch. You know, it's that topical administration, and you don't have to take anything by mouth or deal with your chemicals. And you can also, at home, you know, just try to exercise as much as possible, walking to where, you know, it doesn't make the pain any worse than it is, but exercise as much as possible. You can't just sit around. Your pain is gonna get worse if you don't be active. And then also eat a balanced diet, you know, getting enough vitamins such as vitamin B and D. If you haven't seen a dietitian, try to see a dietitian if you can. They could help you come up with a healthy plan for your healthy diet. And like I said, once you see your doctor, they can prescribe you some medications. So maybe you could take some over-the-counter stuff such as ibuprofen or aspirin. Have you been trying some of those?
Yeah, yeah, a few of them, but like I said, I'm tired of the pills. So
Right.
if I can avoid that and do another method or treatment, I'd rather do that.
So just some of the things I've offered to you, do any of those
Y-
sound good?
Yeah, I can definitely start, the diet and the exercise and all that, and I'd like to continue working with you. So, if you're free, we could set up for the following week or 2 weeks from now,
Okay.
and keep going. Yeah.
Well, definitely look out for the following things if between now and the next time we meet, such as if you find yourself avoiding work because of the chronic pain or your worries, if you find yourself having severe depression, if you can't get off the couch, you're having long spells of long crying spells, or you're sleeping longer than normal, like 10 or 12 hours, not being able to get out of bed. If you have more anxiety that you've been experiencing, if you have excessive pain behavior, or you find yourself being dependent on any of the drugs, if you do choose to try those out, or having any family or marital problems from the chronic pain, if you experience any of those things, give me a call and we'll try to set up a time to see each other earlier.
That sounds like a plan.
Okay.
All right.
Great.
Thank you.
Thanks.